all. This is Dr. Mubin Sayed from Drbeen.com. Welcome to one more show. So today we have Michelle Zimmerman with us. She has been interviewing with me before as well. She has been on this channel before. Michelle was injured by JnJ some, I think, years ago. And what I really appreciate about her is her tenacity and more power to you, Michelle, that her, after being severely vaccine injured and still trying to figure out what is the right solution, what may be the pathogenesis. And she was speaking with me and she made us a comment that some doctor managing her said, you now know more science than me in this area. So as sad as it is that she is still suffering, she is a story of inspiration as well, and she continues to bring us solutions that she has tried. So, Michelle, welcome.
Thank you.
So, let's start with this. Before we go to your presentation, how are you doing? How many months now in this? And we all understand that being vaccine injured, and especially with the neurological symptoms, you may be struggling for the words finding or sentence constructions or saying your thoughts. So please don't take any pressure, just whatever, and take it easy.
Thank you. So I was vaccinated March 14th, 2021, and my symptoms started immediately and progressed and never resolved. So I am still unrecovered. I'm still considered fully medically disabled. I'm not cleared to drive or return to work. I was cleared to travel to New York to do microclot testing, and even the plane flight there was able to track pulse ox, and oxygen levels dropped, which matched with symptoms getting worse. So it's still nowhere near normal life. I'm getting better or more improvement in vision through vision therapy, and still going through speech therapy and vestibular therapy, but it's been a long road.
Thank you very much. So why not we do this? Let me share your presentation as well, so we can actually go in a more structured way. The important thing that I want to share with the audience is that Michelle would talk about mitochondria and mitoswab, which has been a test that she's been using. I think neither Michelle nor I have any relationship to or any commercial interest or any financial dealings with Mitoswab, other than maybe Michelle getting her tests and paying for that. That may be the financial dealing that we have, unfortunately. But there is no other strings attached. And that is why this is not a commercial for one product, but this is an interesting product to discuss. So I'm going to share my screen and we'll go from there. So this is Drbeen.com. In the link of this, in the description of this video, there's a link to get access, and that is as fast as I can do it. Here is your presentation, Michelle. I'll drive it and you tell me.
So I wanted to try and pull some of the things together, and thank you for Dr. Bean having so many consistent, how these different pieces work, because it's been helping me pull together pieces that I couldn't figure out on my own. But what we do know for sure is that there's some kind of vascular inflammation and endothelial dysfunction linked with spike protein. We know that that combination can impact mitochondria. And we know from my tests that spike protein has been found in my monocytes and persisting for quite a long time prior to any COVID infection. I did get a COVID infection 16 months after vaccination, where I was still unrecovered from vaccine adverse reaction, which worsened my condition. So where it was primarily in the non-classical monocytes with just vaccination, after COVID infection, it was in classical, non-classical, and intermediate monocytes. So it looked a little bit like a spike magnet. So we have that in data, and that was conducted with flow cytometry. So that's not a question of whether that's in my cells and persisting or not. So this new data that we have since last time I talked, I did show the brain spect scan, but new to that one was the QEEG with WABI, and then cardiopulmonary exercise stress test that showed lactic acidosis in the absence of ischemia, no heart and no lung problems. My blood oxygen level was normal. So I came back to Dr. Bean and I said, what do you think's going on? And he said to look into mitochondrial function. So when I asked some of the doctors and researchers working with me at the time, they said possibly, but there's no way we can confirm that. So that's where the mitoswab test came in, was fascinating. I was thankful to someone actually on Twitter who'd been following what I posted on lactic acidosis in some of my labs, and then tagged me in someone else's post that just completed a mitoswab test. And I asked the person what the test was, where they found it. They directed me to the website. And before I do anything, I want to make sure that I'm finding out more about the company. Are they a certified lab? What types of information do they have? What research backs it up? Before I even go forward and check with my doctors to say, would this make sense for me to try this kind of test? So from there, I found out that it appeared to be somewhere around 84% correlated with gold standard muscle biopsy. And at the point of going through 2 years of painful and invasive testing, the idea of a cheek swab versus a muscle biopsy was really interesting to me, and hopeful that even if it wasn't 100%, like no test is 100% accurate, that it could at least give some kind of insight into what might be going on. And so that test has been useful. And then the microclotting and platelet hyperactivation, I just got confirmed is still going on. Thank you to Dr. Petrino's lab at Mount Sinai Hospital, some part of that research there as well.
So just a quick note to everyone. As you can see, my picture has disappeared. My camera has been turning off because of heat for some days now. So my apologies. While Michelle continues, I will go and check what's going on with the camera. In the meantime, there is no Mobeen's picture. Thank you, Michelle. So what is interesting for me is in this discussion here, I had always suspected that lactic acidosis is to be blamed for muscle pains, nerve pains, and for dysfunction, fatigue, and other dysfunctions. Of course, there are so many other pathologies that can cause that as well. And I thought it was mitochondrial damage, because if you have proper nutrition available and oxygen available to a cell, and the cell still cannot make proper amount of ATP and instead makes less ATP plus more lactic acid, then that means there is a problem with the mitochondria. So it's very interesting that, Michelle, you have that here as well. All right, I'm going to go to the next slide. So is this the symptom set on the
Yes.
left? Okay.
It's actually kind of two parallel, and I broke it up like this for a couple reasons. It's very hard when someone says, what are your symptoms? Because it's such an extensive list. So I tried to think about how to group it in a way that seemed more straightforward. And the two new diagnoses I have are hypoxic ischemic encephalopathy and mitochondrial metabolism disorder. So trying to describe what are the symptoms that these two diagnoses capture. It presents like hypoxia. One of the technicians running the cardio exercise or pulmonary stress test said, I presented like someone who looked like a mountain climber who was going through hypoxia. I had problems with gait, speech problems. I started getting burning pain, but my heart looked great. My lungs looked great. So he brought up that comment. And then one of the other technicians looked a little bit shocked because she kept saying, go harder, you're doing great. You must have been a high performance athlete. And she just said that people usually don't get to that level. And then when she looked at the level of comparison between baseline lactate and near peak exertion lactate, her eyes got wide and she said, your level's at 16. And at that point, I couldn't think of anything. I didn't know what that meant. I had no idea. But when I contacted Dr. Drbeen afterwards, he pointed me in a couple different directions, and I started looking up things online, and I found some commonalities with levels that got that high for lactate. And I saw things like carbon monoxide poisoning, cyanide poisoning, heart attacks, those types of things where ischemia is present. And so when I started looking up the symptoms of cyanide poisoning and carbon monoxide poisoning, I make it clear that I'm not saying it's that, but the cascade that starts after those when mitochondria goes out of whack and when there's not enough oxygen making it to tissue, that same cascade with the same type of symptoms are what presents. So I can sound and look normal for a little while. And for the longest time, we were saying, why does it look like a new concussion after exertion? but it appears to be that similar type of cascade of events that occur and that are definitely linked with elevated lactate levels. And when we compared the quantitative EEG, there was a drop in voltage at the same time there was an elevation in lactate.
Thank you very much for sharing that.
Things that I'm doing now is people say, well, what are you doing currently? What are you trying to help yourself with? I'm still in all those types of therapy, vestibular, vision, speech, and physical therapy. I've recently started B12 methylcobalamin injections, NAD. I tried first precursor for 6 weeks and I noticed no difference, no change at all. And then I was talking to some other people to find out what other methods existed. I know IV existed, but some people with my similar symptoms mentioned that they went into muscle spasms or contractions and then had some worse symptoms with it coming too quickly into the bloodstream. So I wanted to see if there was something in between. I suspected the precursor was maybe not effective because of gut microbiome dysbiosis, maybe not absorbing it the same way. So I came across iontophoresis and transdermal patches that allows, it's got a charge on either side of it. It looks like a big Band-Aid. I probably should have put a picture of that. But it allows the NAD to absorb through the skin across 4 hours. So rather than being hooked up to an IV, you can move about and then you can still get gradual NAD. And that one, I could notice a marked difference specifically in the length of time I could sustain speaking or cognitive load, and also gait stability, where I could walk without assistance. The downside of those, the saline side of the patch sometimes can cause skin irritation. So that group recommended I try injections just to switch it out and see how that goes. So that's where I'm at right now with that. Still not cleared for any cardio. We got that confirmed again through physical therapy. So my pulse ox keeps dropping. At one example, just while I was in PT, they wanted to try getting a baseline and have me walk over to do supervised cardio. And my pulse ox dropped to 88% just within 30 feet of walking. I don't feel like I'm out of breath, like gasping for breath, like people would expect at that level, but it's neurosymptoms, vision changes, gait stability, burning pain, all those types of symptoms happen when the oxygen level drops. So between that and now confirmation of very visible microclotting, I've been advised, at least until they can figure out what to suggest, no cardio. Then daily things, all this together can take up to 4 to 6 hours a day between hyperbaric oxygen therapy, photobiomodulation, syntonic phototherapy, intermittent fasting doesn't add more time, and then sauna.
Interesting. So tell me this, as I understand, you're not recovered. However, it seems like these therapies are at least keeping you maintained. And if you don't do it, you decline. Is that a correct way to look at it?
And I think the best way to describe it is I can sustain tasks longer before burning pain starts and before nausea and before that same symptom set of cascade, what you would see in like a hypoxic type situation, and quicker recovery. So if that starts, if I get into hyperbaric oxygen relatively quickly afterwards, it can cut off some of the edge of some of the burning pain.
And talking about hyperbaric, you mentioned that because your parents also have, and my apologies, as this camera is just, I do not know what's wrong with it. So please bear with me while I do not appear and then appear. You said that your parents, your family also have signs and symptoms of injury. So you have bought your own hyperbaric chamber.
Correct. We all had the same batch that is in question of whether it was among the contaminated lots, and other people with the same batch are having very similar symptoms. So we all had tested positive for microclotting and hypoperfusion and mitochondrial metabolism. All of these were dramatic changes right after the vaccine. All three of us were highly active just before this. My dad was running 9 miles a day. My mom and I were gym workout buddies, weightlifting. So we know that it wasn't like a genetic mitochondrial condition that was existing. It was just abrupt from the day before vaccination to the day after of having that change within those next days.
Understood. Thank you very much. So this is your, and and my camera just disappeared. So I'm going to leave the camera off for the time being. So this is your current regimen.
Correct.
And here I see MitoQ or CoQ10, which I had discussed once as well, that it is very interesting for mitochondria. My suspicion is that you have tried all of these and then you have quit them and you felt, hey, I need to keep taking them, otherwise I don't feel as I was before. Is this true?
Methylfolate and methylguard, absolutely for sure. The rest on the list are ones that I've just, I would say within the last couple of months started, so I want to give it more of a chance. The Natto I just started 2 weeks ago. The MitoQ I started in, I believe it was December or January. And that one, because I can't quite tell one way or the other, when I've started and stopped it, I'm at least continuing it for a while. The urolithin A, I found some papers on that one, thankfully to another community member who passed it on to me. I thought it was compelling because intermittent fasting has been something I'm doing for hopefully autophagy. And then because of not being able to exercise, I don't have that option to help with that process also. And this urolithin A was shown to help support mitophagy. So I thought at least until I'm able to exercise again to see if that makes a difference, supports mitochondria. The next one, I don't know how to pronounce it, but that's thanks to another as an MIT researcher who pointed me to that. That's been beneficial in some MECSF communities. I tried it for a week, the week before I got COVID, actually, last year. And I couldn't tell if it was a fluke that I was starting to feel a little bit more, being able to sustain a little bit more, or if it was related to a couple of these. I stopped it when I got COVID, and then I went through a series of clinical or different types of trials. So I took all of these things out so it wouldn't be a confounding variable while I was on different types of trials. So that one's pretty new again, just within this last week.
And how about fish oil? Has this been, and zinc? How have they?
On the bottom group, I separated out because they're all ones that I've tried for long stretches of time and then stopped them and noticed no difference one way or the other. But I'm not sure if that means that it's just not noticing any symptomatic difference, but it's doing something internally. I don't know, but I figure those are not harmful to take. So I'm continuing those.
Got it. Thank you.
So this is the image from my blood, thanks to Petrino Lab doing the microclot testing. I split the screen just to show both at the same time. The first one was the green fluoresced is the microclot, and then the one on the right side with the little red dots are fluoresced for platelet hyperactivation. So I was talking with one of the researchers, and she mentioned that this size is fairly large for the types of clots they've been seeing with people. I didn't know what to compare it to, but I looked up just for reference and saw grains of sand are about that same size. So I guess theoretically you could see it with your eye, and that would make sense that that could block capillaries and oxygen flow.
And according to the doctors, these are bigger than they should be, the microclot.
Correct. And so just even trying to look to say, okay, what do we have that corroborates with various different types? We've got the type of serum blood test, and I showed this on my other ones as well. And I highlighted that SCD40L line just to show how highly elevated that was. That was all prior to any COVID infection. And we know that that's a marker of platelet activation. When I talked to several of the different researchers from different teams, I said, does this marker match up with what we're seeing in the microscopy, so that the platelet hyperactivation and this elevated marker would be possibly indicating the same thing, like just from two different viewpoints? And the consensus seemed to be yes. So what I'm interested in right now is we know that you can collect data at one point and something can fluctuate. You get 3 data points and you start possibly seeing a trend. But then if you can corroborate data from very different groups, very different styles of testing, and then it's like looking at through different windows, I think that's really compelling because it gives a different kind of picture of what types of tests show us things. Especially if something looks really high or off, it's easy to say, well, maybe that was just an error in the lab. But when you see it in another setting, it's just really interesting for me to see overlap across these.
Got it. Thank you very much. And as folks can see, I continue to struggle with my camera as well, so my apologies. Let's go to the next slide. What is this?
I wanted to put this image in because I know I've mentioned this one in prior talks too, but the SCD40L marker seems to be one that many medical professionals are not familiar with. And a couple people that I showed it to who are used to standard like D-dimer and things like that would say, well, this tells us nothing. We don't know what this even is. But just to bring it up again, that the American Heart Association has known about soluble CD40 ligand, at least since, look at this year again, it was 2002. So it's not new. It's not a surprise to circulation or American Heart Association, more a matter of gaps between research and clinical practice, that these labs can tell us something, but they're just have not typically been commonly used and for people to be familiar with.
Got it. Thank you very much. So the action item here is that if somebody is vaccine injured, neurological symptoms or other cardiovascular symptoms or hypoxia or acidosis type symptoms, then it may be interesting that if you suspect there may be clotting going on, then check the CD40L levels.
And I was just going to ask Dr. Bean if you wanted to mention any of these things, or otherwise we can just skip by them. But I like how you explain things or possible connections.
Absolutely. So I'm actually waiting for your slide where you'll talk about the complex 4, and I would chime in over there as well. But here, platelets release mitochondria serving as substrate for bactericidal group 2A secreted phospholipase A2 to promote inflammation. So phospholipase A2 or PLA2 is also a toxin that is released, and again, inflammation. So we'll talk a little more.
Just noting that connection between platelet activation, we know platelet release, and then there's the connection between mitochondria. Early on, I heard, well, what does mitochondria have to do with blood, which does that have to do with platelet activation? And the more you look into some of the research pieces, it appears that there's a lot of overlap between some of these features.
Got it. Thank you.
And that we've just known this for a while, that endotheliitis plays a role, whether it's severe COVID or whether it's long COVID or post-vaccine adverse reactions. We're seeing parallels across these different groups. And then this was, for those who are wondering or questioning, this was highlighted, shows where the gated percentage is evidence of spike protein. I'm not talking about antibodies, but the actual spike protein that was visible through flow cytometry. You want those to be at 0. And so that was the first time that I saw evidence of spike protein still in my blood. It was September of 2021, and I was vaccinated in March, and no COVID infection, negative T-detect, negative nucleocapsid. Serum study showed no antibodies to any other glycoprotein other than spike. So on and on of multiple different corroborating, but spike protein still in my blood that was persisting from one single dose.
And is this the test that is done by Dr. Bruce Patterson's team, or this is done somewhere else?
This was before it was released to the public, and I'm part of their research. So it's under peer review right now, but my data is actually in that study. So whenever that's released, this screenshot that you're seeing is actually part of that research.
Got it. Thank you very much. Oh, look, my camera is off. So here we have Drbeen in a different way.
It's almost like I predicted, so we need to have you there.
Yes. So this is the mitochondrial dynamics. So yeah, we've been talking about spike protein destroying mitochondria for some time.
I just for people to know that these exist. This is from Harvard. It has a 3D animation of the citric acid cycle. I liked the animation because when I first got the MitoSwab results, which will come up soon, I was going, okay, I don't know what this means. I see complex 1, I see complex 4. I can't picture it. That's part of the brain damage I have also, that I can't visually picture things anymore. I used to be really good at it. So seeing animations like this really helped me to see um, areas that we have data now that show abnormalities.
Absolutely. And just for the audience's benefit, these two complexes, 1 and 2, primarily take the protons or the electrons from FADH2 and NADH, and then they just have them go downhill from there to complex 3 and 4. And in that process, what happens is protons that are on the inner side of the mitochondria, they're brought out here in this space, and then those protons want to go back in because of the concentration gradient, and so they go back by pushing this motor. So the energy that they have, like little naughty children who want to go back in their other room, and as they kind of uh, go through and push through this machine, ATP synthase we call it, they actually physically rotate this, and that rotation harvests that energy, and then ATP is formed. So this is where I wanted to chime in, that in the mitochondrial damage, the complex 4 sometimes, and sometimes other complexes, they stop working correctly. And when the mitochondria is not able to make ATP in the correct amounts, then the whole cell starts falling apart. Mitochondria would start releasing something called cytochrome C, which is a marker or a mediator of inflammation, and it is a sign for the immune system to say this cell is in trouble. And secondly, because less ATP is being produced, cell would start doing anaerobic respiration or less aerobic respiration, and the acid production will increase. So now the cell is in an inflammatory state. The immune system around this is now alerted as well to kill the cell or help the cell. And the cell is now also producing lactic acid, which would cause lactic acidosis. There is another problem, Michelle. The complex 4 contains nitric oxide with it. And if it isn't working correctly, it will not modulate nitric oxide. And nitric oxide is really important to modulate the blood vessel diameter to control the oxygen and nutrition to come in. So the whole tissue starts falling apart. So, not a good thing if mitochondria is damaged.
So could that explain then why the photobiomodulation on my hands would reduce what looked like Raynaud's like symptoms because it was helping with some of the nitric oxide? Yes, because of my speech.
Absolutely. So let me explain that part. This would be done both by methylene blue and photobiomodulation. What happens is that in near infrared light, it has a spectrum that intersects with the complex 4. So complex 4 is also called chromophore, just like chlorophyll in the plants. The complex 4 in the mitochondria is able to take the energy from light and convert that into electrons or in its power. So what happens is when you're doing photobiomodulation, when you're using near infrared light, that comes and intersects with the complex 4, provides it directly the electrons that it needs from the downstream or upstream complexes, and all of a sudden complex 4 starts working. When it starts working, number one, it will start pushing the protons outside, and these protons will then pass through the ATP synthase, this motor, and we'll start having ATP, and the cell would kick start again. Plus, complex 4 would start releasing nitric oxide because now it is functional. And that nitric oxide would go out and dilate the blood vessels, increase the blood flow, and all of a sudden, the whole tissue would start rehabilitating as well. More nutrition would come in, more oxygen would come in, lactic acid will be washed away, the waste products will be washed away, and the cell, the whole tissue, the mitochondria, then the cell, then the tissue, all of them would start becoming improved. And as much as my camera is off, I am very animated when I am
Excited.
gesturing about it. So just imagine being today. Okay. So thank you for this, Michelle.
So this is the first page of the test results, just cropped in there. I know it's small for those of you who are looking, and I'm going to scoot up a little bit so I can look at the numbers again. So what they found was, say about fivefold increase in the normal mean activity for citrate synthase, which later on they mentioned was likely compensating for mitochondria not functioning normally. And then the activity of respiratory chain complex 4 was statistically significantly below normal range. And then respiratory chain complex 1 was also below normal. So it was fascinating for me because I had the lactic acid levels. I had ruled out that it was not heart, it was not lungs, it was not because I didn't have enough oxygen in my blood. But then the question became, what's going on? Because those of you who saw my first video, I showed the brain spect and the hypoperfusion where blood wasn't making it normally to frontal lobes, cerebellum, temporal lobes. And so the question was, what's causing that and why is it ongoing? So the curiosity here is, was it something with hypoperfusion immediately post-injection that created something like an ischemia, which then in turn created dysregulation of mitochondria? I found a bunch of papers that stroke alone can dysregulate that. So was it like that kind of direction, or was there a different direction where spike protein impacted mitochondria directly and then kind of like a feedback loop, or was it both? So I'm still curious, but this data at least gave something to show that it wasn't a fluke reading with the lactate being that high. Secondly, another researcher told me that we checked my liver enzymes later, since my liver enzymes had been really normal this whole time. But after that cardio stress test, a pulmonary stress test, the liver enzymes had elevated dramatically. And they said that that was probably a good piece of evidence that there was not a fluke in the lab with how high the lactate levels were, but that my liver was really trying to clear what was going on. That piece of information made it was interesting to me because for all these 2 years of trying to describe when I exert, whether it's vision, speaking, balancing, standing on my feet, and then turning my head and trying to talk, any of those things, it results in severe post-exertional malaise. And so the question is like, what is causing the severity of this, and why after exertion in any of these levels? So to be able to see some kinds of data and how those match up, and how the voltage in my brain on the same day that there was lactic acidosis, voltage decreased to lower levels than traumatic brain injury patients. To see hypoperfusion, so like blood flow levels change, makes me curious now with the vasodilation or some of the nitric oxide, if that contributes to like a vasospasm and some of the pain. So all that's just fascinating to actually see data that supports.
So this is a very important thing. What Michelle is showing here is the mitoswab test and the test's results. And I'm reading them as well. And I would have actually suspected that there is something going on with the complex 4. So they're showing complex 1 and 4 both uh, damaged or both not functioning correctly. And if I go back to this one, this is the complex 1 over here. This is working with NADH and FADH2. And the other complex 4, as I mentioned before, is working with everything that is coming from there. Plus it takes oxygen, and then it makes water and carbon dioxide, and plus does the other things, nitric oxide and stuff that I spoke about. So if complex 1 is not working for any reason, you can kickstart the complex 4 by photobiomodulation and or methylene blue. They directly work with complex 4, and they can help you bypass the remaining chain. Once the mitochondria starts working, starts producing ATP, and stops producing inflammatory markers as a sign of, hey, I'm in trouble, and once the cell starts having sufficient amounts of ATP, the cell would also stop producing the inflammatory mediators for the immune system, and the lactic acid will be washed away, the waste products will be washed away, the nitric oxide will be present, the fluids and the oxygen and the nutrition will start coming in, and not just the mitochondria, the whole tissue would heal. Now, Michelle, you mentioned that what may be the pathology. So yes, spike protein directly causes damage to mitochondria. I've done that discussion. The discussion that you just mentioned showed that spike protein destroys mitochondria. The second problem is that if the mitochondria cannot work directly as well, let's say because of the endotheliitis, and that has caused vasoconstriction, and that has caused hypoxia, which is kind of an injury, right? So traumatic brain injury, or TIA, transient ischemic attack, is what? It is an ischemic attack. There's less oxygen coming in as well. And so hypoxia is occurring too. So that would also cause mitochondrial fragmentation. And that mitochondrial fragmentation occurs when the mitochondria are under stress and they are thinking, maybe we are not working correctly. So why not we make more baby mitochondria, and they would come into the play and they'll start working. And so fragmentation of mitochondria is an indication of damaged mitochondria, and these little baby mitochondria cannot really work as efficiently. So all that is happening is mitochondria are just continuing to build up as small tiny mitochondria, fragmented mitochondria, but they cannot function very well. And so it is very interesting for me to see the mitoswab kind of indicating some of these pathologies.
And for people who are interested, it just looks like a Q-tip, and you swab the inside of both of your cheeks for a certain amount of time, put it in a little plastic holder, and ship it off. So it was the least painful test that gave very useful information.
So
I asked for the Mitoswab Plus. So this is the page for, was it? Oh, this is still the interpretation, the first page. They have Mitoswab that looks at just complex 1 and complex 4. And then they have Mitoswab Plus that looks at complex 1, 2, 3, and 4. So I requested the Plus, but it looks like I forgot to put the Plus page on there. But this is the interpretation side.
No worries. Thank you very much. So are we ready to move from the Mitoswab and to the next slides? Or
yes, I got really curious about, okay, so we know that there's something wrong with mitochondria. We can identify now that complex 1, and knowing that NAD is part of that. My complex 2 came out normal, and I thought that was interesting because when I heard people say, well, if you take CoQ10, you'll feel so much better, you'll notice more energy, made me wonder if that was normal, and if I was taking CoQ10, if I wouldn't really necessarily notice a difference there. So that got me to the question of, okay, what's causing or what's blocking what I need for NAD, or is it just the complex itself that's damaged? So I wanted to see if there was anything surrounding methylation pathways, because I got really interested in that. Thank you to a bunch of people on Twitter who started sending me some of their labs, and I started noticing patterns, things with various different types of labs, but they all were linked into the methylation cycle. And each of the people who showed me their coenzyme Q10 levels were normal. So I thought that was interesting because mine in a different test showed normal also, yet there seemed to be something going on with the methylation pathway. So I wanted to see, because there's the question of like B deficiencies where a lot of these symptoms mimic that, but my serum B levels were normal or even elevated since I was supplementing. But that's where it got interesting with gut microbiome test, because serum level could look normal, but the gut's ability to produce B3 to then convert to NAD plus to be used by in the electron transport chain made me curious how much of this is interplaying there as well.
And thank you very much. And Michelle DD says, maybe you should try hyperbaric oxygen therapy.
Yes, we have that.
You actually own a chamber, right?
Yes. It was one of the things on the first slide that I said I use daily. So that was interesting on that. COVID-19 being a methyl group assault as a suggested possible mechanism of some things that might be going on. I reached out to the authors the year that I found that. So I guess it was pretty soon after it was published, just to ask, could this possibly happen post-vaccination? Could it be like a methyl group assault? Let's say your body's trying to keep up with demand of using B vitamins to try and repair damage or whatever the case is. Could a similar cascade occur there? They said they were interested in the question. They discussed it among each other and said it was probably completely unrelated to vaccination, but only the virus. However, that was before more came out about spike protein being connected with all of these. So I'm revisiting this again, and looking at some of how, like the one carbon metabolism, methylation, B12, and mitochondrial function. So just to bring that up.
Right. Thank you. And I am very mindful of your time as well. I know that this is exhausting what you're doing. For the rest of us, it might seem like a normal thing, and I understand that this is taxing. So you can totally decide wherever you want to stop. We can continue at a later time as well.
Thank you. I just wanted to put this, oh, maybe a couple more. Wanted to put this one up just to show that when people say, oh, you must have been deficient in B12 or folate, I was supplementing. So my, again, serum levels were just fine, and even high, but still having things like muscle spasms, still the same cascade of symptoms that you would see in a B12 deficiency. So I think the next slide, unless you wanted to say anything else about that one. Yeah, this one's the Thorne gut health test. I've been so fascinated by gut microbiome, and especially people you've interviewed on here, and just those gut-brain axis topics. I was interested in this one particularly because I knew that it did have a component of AI. I knew it outputted a massive amount of data and provided spreadsheets to look at also. Amy Prohl, one of the researchers who looks at gut microbiome often, she was interested in seeing mine. She said, yeah, it gave really good data. So it also gives a dashboard, again, not associated with Thorne at all, not no financial interest or anything, just curiosity for myself. I appreciated that this one section showed your gut's ability to produce micronutrients. And this was new to me. I didn't, for whatever reason, didn't realize the gut had the ability to help produce usable micronutrients like B vitamins. And I thought that was interesting because this is really similar around the time that those levels were just taken. So serum folate could look really normal, but the gut's ability was in the alert side of it. And then it took me, I don't know, several weeks, months, something, to make the connection that B3, thiamine, NAD are all around the same, in the process of conversion for use in mitochondrial function. And then I went back and I go, wait a minute, B3, that was one of the ones that was an alert there. So it made me curious how that could be related. And then you can see the B12 low also. How much of it could be that serum levels there, but it's not converting to usable form? And could that be going along with the methylation pathway in some gut-brain axis?
Thank you.
So just some that I was trying to understand some of the ischemia, looking at pH levels in the blood when there's switch from aerobic to anaerobic metabolism, lactic acid production. And then I think the next one shows my labs, just as the comparison. That was from the level peak exertion or near peak exertion.
So the standard range 0.4 to 1, and your value 16.
I looked up a couple textbooks, and the highest their scales were to 8, and they said it was severe. And so I wanted to see if I could find anything that showed the 16 range. And that's where I found the Johns Hopkins webpage, and it mentioned kind of scale ranges of when it gets that high to 10 to 15, and then above 15 and how not too great. So it's just interesting to then cross-reference to say what is normal, what is not normal. Does this help explain why I feel so horrible in these places? And when I'm saying I feel bad, it's really bad. Because sometimes people will look at those of us who are going through these symptoms, who are pushing through and trying really hard to look normal, and say that can't be that bad, until they look at a lab and go, how is that possible? You're even functioning at that level.
And I want to thank you as well that you are doing all of this while you are injured, and you're trying to find the solutions, and you're educating everyone, and you're writing a book as well. So thank you very much. And then you're doing these shows to share this information too. So thank you very much.
Just because I know people would say, well, what was pre-post? What did it look like before you started the exercise stress test part? What did it look like at peak exertion? Interestingly, they thought that I had to stop because my legs were tired. My legs were not tired. I could have kept going with my legs, but I became so dizzy, nauseated, my vision changing, burning pain in my head. The room felt like it was spinning, very similar to the first few days after vaccination, where I had to counterbalance, pull myself to hold on to like the handlebars so that I wouldn't fall over. And that was the point where I said, I can't go anymore, and had to stop. But to see that the levels were appeared within normal range just before, and just within what, 6 minutes or so, to have that drastic of a change.
Got it. Thank you very much.
I got interested in this too. What can I find out there on mitochondria? And this series of research seemed to come out somewhere around 2018 to 2020, and kind of probably got in the background of some of the COVID and pandemic research coming out. But it's interesting, and I want to look into it more. I didn't know there was free-floating mitochondria, and it appears as though the researchers are finding some really fascinating things that we didn't know mitochondria did or were involved with, including possibly migrating to where there are areas of damaged tissue to help support ATP production.
And this is very interesting. To be candid, I did not know that there are free-floating mitochondria that are physiological, meaning pathological. Yeah, when the tissue breaks, they can be out there. But physiological, that is normal mitochondria, running around. So thank you very much for sharing this.
And we already saw that when I doubled that image. That's why I put it there. I forgot. I knew there was a reason. When I reached out to Dr. Petrino's lab, he's part of the one of the webinar talks with the group who's part of the Kindred Hugo Health Yale research study. And we had the opportunity to ask questions in advance. So I just threw this question out. I said, have you ever considered connecting data from QEEG like WAVI with something like the TrailsB test and seeing microclot load? And I talked with him a little bit more afterwards. And so we discussed this, why I came up to this question, because of a lot of the cognitive tasks that it can look like I'm normal, I cannot fake TrailsB task. You can see on this top one, I've had multiple different formats of this. Mine came out to the first percentile of very low, showing likely indication of dysfunction. Part of it's visual scanning. Part of it is trying to keep in mind of how you're going from 1A to B, 3C. The slightest little sound or noise throws off the progression of being able to find what's next. And it will take me a really long time to even try and get back on track. The second bar is the first QEEG one that captures the brainwaves while you're doing that trails making test A and B. And so you can see mine was at 167 seconds, where the target range is between 43 and 83. So I just wanted to see what was out there in clinical neuropsychology, what was normal, what do we see for age groupings, and it was very abnormal. So the QEEG one is interesting to me too, because people can try really hard to look normal on cognitive evaluations, partly because it feels like an ego thing when you know something looks easy and you should be able to do it, to try really hard to look like you're scoring better. And so that unfortunately will result in some people coming out as looking like they're normal or within normal range, and there's nothing wrong with you. Long COVID, post-viral conditions, ME/CSF, post-vaccine. And that causes a source of frustration, which is funny because people go, oh, you're faking things. And this is totally the opposite. I was talking to an attorney who's going through this as well. And he's like, yeah, I can't even bring myself to do this because I know I can't even work around it. So this one paper that was talking about QEEG mentioned that a benefit of looking at voltage levels in the brain where MRIs might look unremarkable, you cannot compensate around managing your brain voltage levels. And so that may be a better sign of what might be going on or deficits than some of the cognitive evaluations. I know Montreal evaluation is one that's being used for long COVID quite often and may not be an effective representation of what someone's actually going on, experiencing. Can't get the words out.
Krista says, have you tried ice baths or extreme cold exposure?
Heat works well with me. Cold is excruciatingly painful and does not go well. On one of the first slides, I showed my hands and how they went white. Any kind of cold around it will exacerbate pain to such excruciating levels. Someone told me early on with headaches, put ice on your head. It was so much worse. So the only thing I can tolerate is heat. Sauna.
So you do so much research. When sometimes you get a chance, look at alpha 2 receptors in the blood vessels.
Okay.
So when there is a temperature swing intolerance, many times there is the alpha 2 receptors that are overactive, which then cause vasoconstriction, which then cause low blood supply and the hands becoming blue and cold and pale. Okay, so thank you very much for this one. Somebody had asked that what is the name of the micro swab? That is mito swab, mito for mitochondria, so mito swab. Swab because it is a buccal or cheek swab.
Yes. And that was just comparison of age groups of what some of the standard trials had seen with trials A and B test and how much. Mine is the one in the box on the bottom where it says 35 seconds and 167 seconds. So yeah, even had substantially more problem than 10% of the population that was at 87 seconds. So it's a blow to my ego, but at the same time, it shows that there's definitely something abnormal.
Yeah.
And those are just, in case anyone was interested in looking those up. That's what the QEEG looked like that the data was collected on. I have a series of them every month from July through December of this past year. So I was able to track what was going on in changes in voltage and how rapidly it can change. One of the days where it looked substantially worse and lower voltage, the person who's collecting the data actually got really concerned and said, "You're getting a lot worse." And I said, "I don't think I'm getting worse. I think it's just capturing one of those times where this whole cascade of events that look like post-concussion." And I kept having this suspicion that whatever's happening, I'll recover from it, whether it's a day or a week or a month, getting back to that pre-baseline. And if it's more exertion, once I had that lactic acidosis level reading, I asked her, I said, for my next scan, is there any chance I can scan on the same day as I have the second cardio exercise stress test? I actually had 3 of those different variations of those because one was an echocardiogram, one was a pulmonary one, and then one was a standard with EKG. So back to back, consistent with those. And so the third one, I said, any chance that I can run QEEG on the same day to see if the if my hunch matches up, if the voltage shows a lot lower, at the same time I'm getting this whole thing of lactic acidosis. And it did. So it was really fascinating to me.
Thank you. Jim says, does she take methylene blue?
I'm interested in it, but I haven't started it yet. The neurologist I'm seeing wanted me to try first with photobiomodulation. He's really interested in that as well. And then wanted me to try another doctor who works with mitochondria wanted me to try mitochondrial supports first. And then these 2 things, I'm trying to decrease too many things at once to try and figure out which of the things are making the difference, because if it's all at once, and I go, wait, this is great.
Yeah, so the quick note on this one is that in terms of therapy or intervention, methylene blue and photobiomodulation together are supposed to be a therapy that actually kickstart multiple parts of the mitochondrial electron transport chain, and they work together. Because the methylene blue, interestingly, which near infrared doesn't do, methylene blue is a redox donor and acceptor both. So that means what? What that means is, and I know I'm a black box at this time over here, but I'm going to just speak it out. So what happens is the electron transport chain can accept electrons, and it can actually accidentally or physiologically release electrons, or not electrons, but the radicals, superoxides, for example, or reactive oxygen species. Some of the reactive oxygen species are needed for some normal functions of the body, especially like in immune cells, but extra reactive oxygen species can be bad. And so think about the electron transport chain sitting in the mitochondria. It needs electrons and it releases electrons. Now, photobiomodulation can bring in new electrons, but if the electron transport chain is making more reactive oxygen species and it is making more, throwing more electrons around, there is nobody to collect them. Methylene blue can not only donate electrons, it can actually take them back as well. So it helps mop up some of the stray reactive oxygen species. So the intervention papers that I have read, in there they kind of combine the photobiomodulation and methylene blue as one package of solution for mitochondria. So I'll be very interested if sometimes you combine them as well, again with your doctor's approval.
Yes.
Okay, so this is the WAVI, and then
And then
are
any
the
of these, we can stop at any point here. It's just a matter of whether you wanted to show any of these images where I was comparing QEG and what was found in SPECT.
I want to go through this, and then I'll once again try to turn my camera on, and it would stay on for 2 or 3 minutes where we can then wrap up. So tell me, would you like me to continue with these slides?
Sure, you could just do a couple of them quickly and I'll show an image of where I mapped onto that CZ location. Before I had any of these imaging, I would describe there's a very strange sensation there. It wasn't like a pain. The best I got to describe it is like if you had the sensation of sparkling water, and when that sensation happened at that location, my eyes would shut where I wouldn't be able to control them. It didn't feel like sleepy. It just felt like it shut. And then my speech would degrade really rapidly. So I'm really interested, don't know the connection, but that location is one that research papers will look at as a stable, if there's a change in voltage, if it drops, it's relatively stable. So any change that you see is actually a change. And they'll look at that level with voltage in mild, moderate, and severe TBI. And that's where my voltage has been lower than severe TBI at that location.
Got it. Thank you.
So that's an example like yeah, you can go to the next one. That shows the levels of what you see in mild TBI was at like 14 microvolts, moderate at 11, severe around 11 and 12. So those were 3 of the different dates in July, August, and later in August. So that decreased hypoperfusion frontal lobes, and that matched up really well with the low voltage in the frontal lobes on the QEG. First round, they even thought that it was possible that the sensors weren't working on the frontal lobes just because the voltage was so low and not reading. But then I showed them the SPECT scan that there was that same kind of hypoperfusion deficit seen there as well. I just was interested in mapping over the heat maps of the QEEG and seeing where some of the higher or lower voltages were, and did they match where some of the gap spaces represented hypoperfusion in SPECT.
Got it. Thank you.
And that's the pattern across time. That QEEG shows heat maps in relative to the highest voltage. So the top row, all of those, the highest voltage reading was at 8 microvolts. Which will be represented in the red color, and then the 0 microvolts or very, very low was blue. The bottom row I pieced together because those were all in times where it made it, or the highest max in that row was 12. So the things that you see lined up there are the exact same date. So right where your cursor is now, if you go straight up, those are both the scan or the reading from September 29th, the top and bottom one rows. The only difference is the heat map relative colors compared to 8 microvolts or 12 microvolts. So you can see on the bottom row, the farthest circle over You can see a increase in red there. So there was higher voltage. So compared to that higher voltage, all the rest of the other earlier ones looked very low voltage. There was the same amount of voltage, but the top reading just shows relative to maximum of 8. So you can see changes across time, and the 12/1 date on the top row, second from the right, that one was the day that I had the lactic acidosis measure as well. You could see some decrease in voltage in areas after I had increased. Just so those are, sorry, I've got echo coming over on the side, and lost my train of thought. So interesting just to see how those pieces are showing some kind of data. We don't know fully exactly what it's showing, but we do see that there's a rapid change possible in voltage. And for me, that gave me hope, because if I saw the exact same low voltage across every reading all the way across time, I would have probably thought maybe I'm stuck here and maybe there won't be improvement. But because there's that much fluctuation, it still gives me hope that there can be improvement. I think that might be
Absolutely.
And we can end anytime now. I looked at, like I said, any of these things that I do, I want to make sure I know what it is. Is there a patent for it? Is there research behind it? Is it an FDA cleared technology? What is it most like? Does it match up with standard EEGs? And so again, before I try anything, I want to know the background of that. And so just finding what this device was, because it looks so simple. And it did show that it was equivalent to standard EEGs, but the quantitative part just gives you different kind of data and mapping.
So Michelle, thank you very much. I think my camera is going to go away again in 1 minute or so, but thank you so much for being here. Thank you for sharing this. And at the end of the day, for the listeners, I think I like Michelle's spirit that she's not here to complain about what is happening, but share about how she's trying to figure out what is the problem and what are the solutions that she has been trying, so that can provide some information to both patients and doctors as well. So Michelle, thank you very much for this.
Thank you.
So there is a question. John says, how do you manage to financially deal with all of this? I knew that you were using your own home's money that you had saved up.
Yes. So
So
I
you were
saved to buy a house, and that is not an option now, because financially, at last count, it was somewhere around $400,000 in financial losses. Still, the countermeasures injury compensation program that is supposed to exist to help cover medical expenses, it's been well over, I don't remember, it's over 2 years now, and still no response for that. So it's disheartening.
Let me ask you this.
Yeah.
I'm so sorry I interrupted you. Please complete your thought.
Oh, it's just that one of the reasons I'm investing as I am right now, making the choices, you see people all the time who are funding research. And if someone's not going to research, especially J&J right now, because that never got FDA approved, it kind of faded into the background. So researchers are really not interested in studying it. If there aren't, then this is essentially like funding to be able to get data, to be able to at least present knowledge in some way. And I'm seeing it as an investment in that. And I'm seeing it as an investment in doing whatever I can, if I can find a solution for myself so I can get back to my life. And that if that can at the same time help others don't have access to the same level of data, to at least demonstrate this is the progression, these are some of the solutions that we can at least try, and then where to go from there.
Thank you so much. Thank you for everything you're doing, and so sorry that you're still continuing. So let me ask you one sentence at the end, one question at the end, which I actually have it throughout. With all of this for these many months, are you still hopeful that you would recover back towards normal? Are you recovering? Do you have that little hope inside?
I do. And that was one of our conversation topics before he came on. Have I ever felt one day where I feel entirely normal? No, but that doesn't mean I've given up hope yet. I know there are people who are saying, well, but you don't know, MECSF have been going 20 years and no change, no hope. But what I'm thinking towards that is, while that very may be true, I am not giving up finding answers, because the body is so miraculous, and so many things that we don't know, that we haven't explored, that it's very possible that finding the right combination can help bring knowledge to other people who have puzzle pieces, and there can be a solution.
With this, thank you so much for joining. I am so sorry that we went on for so long, and I know that you must be exhausted as well. So would you now use the hyperbaric
Yes.
oxygen chamber?
I'll
So
probably do
good luck.
infrared first, photobiomodulation, and then right into HBOT.
So thank you very much. Have a great weekend. Praying for you and working for you as well. I keep collecting and finding solutions that I can present. And when I'm doing it, I'm hoping it would help you and it would help a lot others, many others as well. So thank you very much. Bye for now.
Bye.